workers starting from the national level to the block level. They have been trained for this exercise. Not only trained, we have also ensured that we had a mock exercise done in stages, ultimately culminating in a national level mock exercise to ensure that even if there are the slightest glitches in the delivery mechanisms, we adopt a preemptive strategy to correct them. Detailed guidelines have been given to all the people in the country, and we have a very technologically superb and perfect network app. Earlier we had a electronic this EV platform. It was an electronic vaccine intelligence network. We have now converted it into a COVID platform, which depicts success win against COVID, and this is tracking everything. The vaccine, its availability at various places, its temperature at various places, transportation from one place to another, and it is also tracking every bit of information related to the potential beneficiary. All those who are being given these vaccinations, they are already on the platform, and now they'll get continuous. They got a text message in the last 2 days also about the place where they will be vaccinated today. And this is happening all over the country. And now in the next 4 weeks, they will again get text messages, reminders about their next vaccination. They will also get electronically generated certificates of vaccination. And of course, all scientific protocols, all public health measures, and this is a moment to thank all the health-related officials, doctors of the whole country, including my colleague health ministers, of course, the Prime Minister of the country who has been leading from the front, who has always been guiding us and taking and eliciting all support from all the chief ministers of the country. So I think there is nothing more. We have been sharing every bit of information during the whole year with all of you, and this is a very, very satisfying moment for me, and I would like to once again express my gratitude to all of you on this occasion.
Do we ask questions?
If you want.
Well, we appreciate your efforts as well, and congratulations.
Pardon?
We appreciate your efforts as well, and congratulations. You say lakhs of workers are involved. What's the total, do you think?
What is the
total of workers involved right now with this effort?
No, you see, the workers had been very, very sincerely working. They had been working.
How many?
You see, it is at different levels. I think at least in today's exercise, more than 1 million workers may be involved, but the exact number may be difficult to pinpoint because at every stage, you see, it's not only the 4 people who are present at that vaccination site who are giving the vaccination. They, from that basic unit to the level at which the whole country is working, they're supported by, so it's a very difficult to pinpoint the exact number, but it will certainly run into millions.
Millions of things.
Definitely,
one other small number question. To get to 300 million by the middle of the year, you've got to vaccinate 1.5 million a day. We're starting at around 3,000 today. How's that ramp up going to work?
You see, the calculation about this was done according to the likely availability of the vaccine.
Oh, I see.
When we had calculated this strategy, we informally could be in touch with the vaccine manufacturers, and we had a rough calculation that say by June, July, August, we should be able to have the number of doses which will be adequate to give vaccination to 30 crore people, right? And that is why we have devised this strategy that we start with the healthcare workers, public and private sector, we frontline workers, police, paramilitary, military, sanitation workers, workers in surveillance and containment zones, those who work in the field, in the municipal corporations, etc., etc.
But you're starting at 3 lakhs.
Then of course the people with more than 50 years of age,
Yeah.
and then less than 50 years with comorbidities. So this roughly comes to 1 crore health workers, 2 crore of frontline workers. It's about 26 crores are like over 50, and 1 crore is less than 50 with comorbidities. That's a rough estimate that we should be able to get vaccines for these 30 crore people in the next 5-6 months. And if you see, if we get more vaccines, obviously at any stage we can revise the strategy, but this is a modest calculation that we did according to the amount of availability of vaccines basically.
But you've got 3 lakh today, around 3 lakhs today. That's going to have to go up to 20 lakh, right? I mean, it's going to have to be, it's going to have to be more than that, right? To get to that
You see, according to the need, you see,
Yeah.
we have a system in place all over the country. We can modify it in terms of magnitude, the number of places where we have to give vaccination. You see, if at one particular place we have one team working.
फिक्र आपकी, सोमवार से शुक्रवार रात 9 बजे सिर्फ TV9 भारतवर्ष पर।